Hi, Dr. Dave Marquis here, and I wanted to continue on in my series of stretches and exercises to include some things that have to do with the lower extremity. And a couple of points that I wanted to make as I get into that is the concept of muscle versus bone and joint. Many times we really focus on the bone itself and forget that muscles are the movers of joints. Why is that important? Well, if you put all of your efforts into trying to prevent osteopenia and osteoporosis, and you're taking all of your supplements, and you're doing exercises that they're allowing you to stay functional, but you're always tight, well, you're probably creating a little bit of degeneration in those joints, because the muscles, if they compress a joint too tightly over an extended period of time, it gets inflamed. And when I say extended period of time, that can be just a matter of days. So in a prior video, I showed you how to stretch out your glute medius and your piriformis and your iliopsoas. Working those muscles appropriately does have a pay forward in how our lower extremities work. And what I mean by that is, when someone presents for something like knee pain to me, and we do a knee exam, and we're evaluating how is the patella tracking, how is the cartilage under the patella, how is the health of the menisci, how are the cruciate ligaments and the lateral stabilizing ligaments, the collaterals. Certainly you can have a tear in any one of those tissues, but that tear is not always as problematic as one would think if the musculature is working appropriately. In other words, if our muscles work right, not only do the joints and associated tissues respond better, but our pain levels tend to come down significantly. So what I'll commonly see with knee pain is that the surrounding musculature just gets out of balance. And I might find somebody has really tight hamstrings because they sit too much. Much like when I was talking about the iliopsoas. If in this seated position, right now my hip flexor is tight and my hamstrings are tight. It has to be because I'm seated, and those are the joints that are shortened. Well, when I stand up and my muscles don't engage appropriately, now my patella is going to start to track to one side or the other because I don't have the stability in the front of the leg. And so some of these muscles in the upper hip actually have a trickle down through the iliotibial band, and it can pull it sideways. What I often see in those patients when I check underneath their patella is they'll have a softening of cartilage under there. There's a name for that, chondromalacia patella, and sometimes it's not a full-blown case, but it's enough that their knee always hurts. And the things that I'm going to show you right now are kind of some hacking procedures that you can do while you're out and about, because sometimes we'll be walking along the beach or we're going for a walk, any place, and you find that, oh, dang it, my knee's hurting, and I start to limp. If you find that that happens to you, there is zero harm in stopping to do what I'm going to show you, and a lot of upside, because invariably some of what you're dealing with has to do with poor tracking. So we already stretched the top side of the hip. I'm going to show you how to do the bottom side of the iliotibial band as well as the vastus medialis here, so that you can have a better chance at tracking right with this patella. What you're going to do is you're going to basically break the leg into three components. So you got the outside, the middle, and the inside. You're going to use your thumbs or some other object that you can apply a little pressure into this, and you're just going to lean back someplace where you can sit, and you're going to straighten your leg. I like to start right where I can feel the tendons come into the bone, and for those who may not know their anatomy, just go to the kneecap and start walking backwards up towards the thigh. So you're going to put some blunt pressure there, and I'm going to start to straighten and lower the leg. And as I do that, you can internally rotate the foot or externally rotate the foot, and you may find you have a little bit of a different pull there. Wherever you find the most tension, stay in that pattern and just walk up, allowing that tissue to get deformed and move that patella. As I'm doing this and releasing the iliotibial band and the vastus lateralis right here, what's happening is that I'm giving a little bit more joint play to that patella on the femur. And in real time, it opens up the space. And also in real time, when you stand up, you're going to have less pain there. And you're going to be able to walk again a little bit further. Do the exact same thing on the inside. Holding that vastus medialis, just walking up the thigh while I extend the leg. And I can literally feel more joint play now in my patella. Anybody can do this safely to increase the amount of fluid and synovial fluid that your cartilage underneath that patella can draw in. And that's really what's important for a joint. They live through motion. And if we're not moving them, they're degenerating. Same thing down for the lower leg. Many times the musculature out here through the tibialis and peroneals gets too tight. And remember, the muscles out here in the leg are the ones that create the arches of the foot. And so sometimes you'll feel big toe pain, and it's coming out of your anterior tibialis or the peroneus longus because both of those muscle tendons insert underneath the foot. So I'm just going to lean back. I'm going to bring the leg up to me, and I'm going to start down towards the ankle, and I'm going to start walking my fingers up. So I basically made a little hook out of my fingers. I'm going to back them up with the other hand so it has a little bit of extra pressure. And I'm going to put that pressure into that muscle as I need it while the ankle and foot roll. Kind of wiggling the toes, rolling the ankle. And I'm just making rows right up the outside of the leg. And like for me, I could feel a little trigger point right there. And so I'm going to roll right around that, trying to get some circulation into that area of muscle, get rid of the trigger point so it gets a little more fresh oxygenated blood. And as I do that, what happens is these tendons down below, they actually have a little more play in them. As they have more play in them, the tension on the joints down below starts to diminish, and so the joint can actually move more efficiently. Another way to do this, because sometimes people's hands hurt and they can't effectively put the kind of pressure into their lower leg that they'd like to. So this can be done in other ways. So I just have a bottle right here, and I'm going to use an edge of the bottle or the whole side of the bottle itself, and I'm just going to cup both of my hands. You can lace your fingers, you can put hand over hand, and I'll just pull that right into it. And so now my hands aren't doing the work. It's actually coming out of my shoulders and my body weight of lifting the leg. So the leg itself is now pushing right into that bottle while I'm rolling my ankle around. Super simple to do. Anybody can do this. Now, let's say you have a reason, maybe your arms and hands don't work and you want to do something like this. You can actually do this against another surface. So I'm going to stand up now and show you how to do that. Now I'm going to show you on this chair how I would do this if my hands and arms weren't working, but I wanted to get my leg and foot to work better. So I'm just going to lean onto the surface of this chair right here, and I'm going to allow my foot and ankle to roll while my body weight pushes against that part of the chair. So you could just get an inanimate object. It might be the edge of a couch. You could actually lay on your floor and put an object under that so that the leg is raised. You basically just need something to push into that muscle while you're rolling the foot and ankle. Doing that type of activity has a great benefit in your overall knee, foot, and ankle function to make sure that the muscles aren't working against the joint. There has to be that synergy. There has to be enough circulation and pliability at all times for our joints to be healthy. And so this is something that I'll teach people to do for the lower extremities, and it works quite well.